have here with me Dr. Charlotte Boughton from the Institute of Metabolic Science at the University of Cambridge in the UK.
Hello, hi.
Thank you for being here, Dr.
So it's a pleasure.
More and more patients with type 1 diabetes use hybrid closed loop systems or do-it-yourself closed loop systems. Mm-hmm. What do they all have to learn before using such a system?
So I think at the outset it's really important to make sure that people's expectations are met. So this is not a plug-in and play system. It still requires quite a lot of user interaction. The basal rates are done automatically, but mealtime boluses have to be given by the user. So some key diabetes skills, carbohydrate counting, maintaining infusion sets of the pump are really important, more important than with standard pump therapy when you're talking about closed loop therapy. So there needs to be a good understanding that the basics are still very important when starting people on closed loop therapy.
Are the existing training programs for insulin pump users and CGM system users sufficient, or what will be needed additionally?
So I think there needs to be an assumed understanding of the pump component and the CGM component of any closed loop system. And there are certainly differences which I think would probably require an additional level of training for closed loop systems to look at the key differences and changes from standard pump therapy. Things like the importance of timing of mealtime boluses has more significant consequences, and considering algorithm learning as well. So I think these would require an additional training program over and above current pump and sensor training programs.
Are such programs already in development?
Yeah, so absolutely. We already have 2 closed loop systems available and being used in clinical practice. So there's a group in the US who've done an approach, it's called the CARES paradigm, to teaching healthcare professionals how to teach users about closed loop systems. And we have a platform as well for our own closed loop system in Cambridge to address these closed loop specific skills that people need before starting out to get the best outcomes.
Patients often have problems with programming useful alarms for being helpful and not disturbing. How can this be taught?
So we proactively teach people to consider alarm burden when we're setting up somebody on closed loop technology, and we talk about silencing alarms overnight and just choosing the alarms that are there for safety, not just because they're there, to try and reduce this alarm fatigue so that people actually respond to the alarms that they need to and don't get habituated to lots of different alarms, which is a burden and we know leads to people not using the technology as well.
Do you think that every type 1 diabetes patient who wants to use an artificial pancreas will be able to be trained for this complex therapy?
So in our experience, we've trained people from 2 years old, the parents of 2-year-olds, to an 80-year-old gentleman who's currently using the system, and haven't found any reason why somebody would not be suitable for a trial of closed loop therapy. Julia Lawton and colleagues wrote a paper recently about the influence of healthcare professional preconceptions and how actually when you observe people using the system, those are very quickly overridden, and some people who they thought might struggle do very well and don't interfere too much with the algorithm and have very good outcomes. So I think we have to exercise caution in our own judgments in clinical practice when we think about selecting people for closed loop therapy. And ultimately, I think everybody should have at least a trial of closed loop therapy.
Okay, thank you very much, Dr. Boughton.
Thank you.